Hello and welcome back to the Polaris Travel Health Podcast. Thanks for tuning in with us. This week, Jayden and I will be talking about typhoid fever.
Yeah, I think this is a disease that's kind of not talked about enough, considering how common it can be and how it can be kind of dangerous for people. So there's two different types of typhoid, right?
Yes, by far the most common one that we tend to talk about is sort of regular typhoid fever, if you want to call it that. And there is another variation called paratyphoid fever. Now, both of these are illnesses that are caused by bacteria, salmonella bacteria. So they're just different subtypes of essentially the same type of bacteria. And we still see mostly typhoid as being a primary thing, but certainly paratyphoid is a bit on the rise. I think the numbers were kind of a wide range here of 11 to 21 million cases of typhoid and 5 million of paratyphoid a year, with a couple 100,000 deaths. Is that what your research said, Jayden? You did the research on this for me better to get the up-to-date stats.
Yeah, I thought that was a really wide range of numbers there, but that's what I think that's what the CDC said in terms of cases, or the WHO or something like that. And that but that seems like a lot. Maybe there's a little bit of statistical problem there.
Yeah, well, I would sort of think that the reason that would be is that typhoid is probably not a reported illness a lot of times. If
Right.
people, because the one thing about typhoid is, and we'll get into this further on, treating it is you may not necessarily need to be hospitalized or go through all the steps where you could be counted.
Right.
So as a result, that would put in a big range. And then not only that, misdiagnosis and that sort of thing. So I think we'll talk about that down the line here.
For sure. So where is typhoid kind of the most common in the world?
Well, by far the most likely risk area for typhoid is sort of in that South Asia area. Your India, Pakistan, Bangladesh. Those are the places that you're most likely. Other countries in Southeast Asia, you start thinking about your, Nepal, Laos, Vietnam, Cambodia, Indonesia. Those are countries which I would view as sort of being the second highest risk areas. But then that being said, typhoid is definitely a thing in Africa and in South America, Central America, even in the Caribbean, potentially in certain areas, although it's not something we typically look at too strongly for resort travel.
Right.
So I usually, when I think of typhoid, I'm always thinking South Asia, Southeast Asia, and then Africa as being the risk areas in sort of top 1, 2, 3 order.
Right. So how is typhoid spread between people?
So typhoid is basically spread through contaminated food and water. So this is very similar to hepatitis A. You have somebody who has typhoid fever and they maybe didn't wash their hands properly after they went to the bathroom, and they're preparing your food, and then they touch your food, and then you eat the food, and then you can be contaminated and infected with typhoid and get sick. So that's typically what you see. And so we see it more often in places where maybe hygiene is not quite as good as it is in other places, where access to even just access to cleanliness and clean water is maybe lacking a bit.
Right. So what are the symptoms, and does everyone get symptoms, or is it the type of disease where only some people will kind of get sick from it and other people will be kind of asymptomatic?
I think when you look at typhoid, a lot of people will end up being symptomatic, although the incubation period can be quite long. You're talking sometimes 2 to 3 weeks before you can get sick. So essentially you can have it and be infected and not feel anything for quite a while. You might be home from your trip, or even if you're on a long-term trip in one of these locations, it would be very hard to pin down where you got typhoid, because you've been traveling for 2 months and it could be many possible places over those previous several weeks where you could have been sick. So, and as far as symptoms, fever, guess what? It's typhoid fever. Fever is a thing, right?
No, really?
Yeah. And general feeling lousy, unwell, feeling headache. And then the other thing, which is a little bit distinctive about typhoid, is that you do get curious looking rash, usually on your body, like on your torso area, not your trunk. And it is rather distinctive looking. And if you Google around and look for images of typhoid rash, it does look different and unusual, and not what you would, doesn't look like an allergic reaction or anything like that.
Right.
And some people will have other gastrointestinal problems than vomiting and diarrhea. But I think really when I think of typhoid, I think of fever and I think of that unusual rash. Those are my two real go-to symptoms.
Right. And so because it has this kind of long incubation period, similar to kind of something like hepatitis A, do we get outbreaks in Canada from people who are returning from one of these areas and then, say, work in a restaurant or at a bar or something like that?
I've never heard of a case where somebody has brought typhoid home and then worked at a restaurant and had a public health alert registered. So I guess it's theoretically possible, but I can't ever remember hearing of one. I think there has been some cases where there's been local spread where somebody spread it within their close contacts, like family members
Right.
or that, that level. But yeah, basically from what I've read in the data, most of the people that have come home with typhoid fever have tended to be people that were back home visiting friends and family. And
Right.
it has not been as much with travelers going to spending a week in Bali. Those cases occur, but they're relatively uncommon. So yeah, I guess that's kind of where I'm going with on all that.
Right, right. So are there any kind of like more serious symptoms? We noted how there was kind of a couple 100,000 deaths every year, or are there kind of any potential long-term effects from having had typhoid fever?
Well, essentially, it's an infection, and you can just get sicker and sicker. Where you can develop shock and confusion, and there can be inflammation of your organs. Essentially, if the infection really takes hold, it can do all the bad things that infections can do when they get advanced.
Right. What kind of are the options for treatment when you do get sick?
So the nice thing here is antibiotics work, right? We can
Right.
treat this bacterial infection with antibiotics. And there are several different antibiotics that have been used. Ciprofloxacin's probably been the go-to for the most part. But we've been seeing more resistance to Cipro lately, but that's been sort of the typical choice. And there are other antibiotic options. So I guess what I would say here is that prompt treatment with antibiotics usually leads to symptom resolution and getting better. And that's why I think even a lot of times some of these cases are not necessarily reported. If
Right.
you're in a small town in India and you get sick and you go see your doctor and the doctor says you've got typhoid and sends you off to a pharmacy to pick up some antibiotics and you get better, I don't know how likely it is a case like that's being tracked by public health and that sort of thing. So I
Right.
think that, that's why there's probably a lot of cases out there that we don't ever report. And another thing too is in Africa, there are a lot of cases of typhoid that are never properly diagnosed. Actually, I have a colleague of mine who was actually involved in trying to do some disease surveillance in Africa where they were trying to figure out the true incidence of typhoid. And I don't know exactly the conclusions of the study, but I do know that he had said that the incidence of typhoid in Africa was way higher. It's just highly underreported.
Right, right. So kind of on like a related note to that, in doing research for this episode, I found that typhoid is actually sometimes confused with malaria, most likely because of the fever. Do you think that that's kind of potentially dangerous, or in most cases, do you think that that situation would kind of be resolved?
So I think definitely you see situations like that. Like in some parts of the world, if you have a fever, malaria is going to be the first thing you're going to think
Right,
about. And we're always worried about malaria because it can just progress so rapidly and you can get sick really quickly. If anyone listened to our previous podcast talking about mosquitoes, one of the things I had mentioned on there, I'll mention it again, is that, once you actually are symptomatic with malaria, you can go downhill very quickly. So
right,
in a lot of places in the world, if you all of a sudden develop a fever, knowing how malaria basically develops and the time frames we're talking about, it's a lot of times it is a prudent thing when you don't have access to proper diagnostic facilities to presume or work on the basis it is malaria.
right.
Now, I guess the thing I would say right now is that obviously quick diagnosis and proper treatment is key, but it is something where I guess once you realize that anti-malarial meds aren't helping, well, I guess you can change course. But I think in a lot of developing situations, results aren't being sent to labs and they're checking things. Lots of times they're just here. We think it's malaria. take these pills, and if these pills don't work, come back. And then if they don't, you come back and then it turns out that they didn't work. Well, then maybe they start looking at other antibiotics for typhoid or something like that. So, not exactly the approach that we would handle it here in Canada, but I think we see that a lot in developing countries.
Right. And so, like, being on a course of anti-malarials when you do have typhoid isn't going to necessarily hurt you, but it's just not going to help.
There is some potential that there could be some benefit, but the antibiotics that we use to treat typhoid is not the same as the first choices we use. The first choices for typhoid and the first choices for malaria aren't the same. So you wouldn't really see that. And anti-malarial drugs are more antiparasitic, although we do see some antibiotics being used for anti-malarial. It starts to get all weirdly mixed in and confused, but if you took antimalarials, they wouldn't hurt you, but it probably wouldn't be ideal, and I wouldn't expect it to clear anything up.
Right.
And if you took the typical choices for typhoid for malaria, they wouldn't do much.
Right. So, in hoping that you wouldn't get sick, what can you do in terms of preventing yourself from getting typhoid fever?
So I think when you think about this, the main thing you can do is vaccination and then clean water, proper food handling precautions. Now, that one is always harder because it's not necessarily dependent on you. It's based on the people that are preparing your food, and you have limited control. It's not like you could just say, oh, that looks undercooked, I'm not going to eat it because of typhoid. Well, that could be a consideration for a lot of other things like traveler's diarrhea, but you can't really see or smell typhoid on food.
Right.
So I always look at it as vaccination is probably your best bet. Now, vaccination is not perfect, but it's certainly probably our most effective option.
Right. So there's two different types of typhoid vaccines, isn't there?
That's correct. So there are two vaccines that we have available in Canada. One of them is an injectable and the other one is an oral format.
So is there a reason why you would get kind of one over the other? Is there like a major difference between the two, just for people that are afraid of needles or something like that?
Well, definitely that is a factor. When you look at the pluses and minuses, there's a bunch of factors I guess you should really look at.
Right.
I'll break this down sort of with some of the basic differences, and then maybe after that we can talk a little bit about why you would recommend one as opposed to the other. So I think right now, talk about the oral. I guess the one advantage there is it is not injectable. So it's a capsule that you take every second day for a week. So you would take it on day 1, day 3, day 5, day 7. So you always have to take the 1 day off in between. And after you take the last dose, it takes a week after that to kick in. And from a side effect standpoint, it can be hard on people's guts in some people. But I think the other thing about the typhoid vaccine in oral format is there are some reasons not to take it in regards to it's a live vaccine. So if you have immunocompromising conditions, you can't take it. Also, another thing is if you are on antibiotics, you can't take typhoid oral because guess what? It's a live vaccine. So it's a weakened version of the typhoid bacteria that you're swallowing. So if you're currently taking antibiotics for a sinus infection, it'll probably kill the vaccine and then you won't get any benefits. So we have to manage that. But the one nice thing about the oral typhoid vaccine is the effectiveness level is maybe a little bit higher than the injectable, and it has a 5 to 7 year duration of effect. So that kind of covers the basics on oral typhoid. Now, when you start thinking about the injectable, it's an intramuscular injection, and so it goes in your upper arm. The main side effect is arm soreness and tenderness. There's no gastrointestinal issues there. And it takes basically 2 weeks to kick in after you've gotten the vaccine. It's an inactive vaccine. So there's no reason if you're immunocompromised or taking antibiotics, or there's really no reason you can't get it from that standpoint. And when you think about the duration of effect, though, it's really 2 to 3 years. So from that standpoint, it doesn't last as long. So that's kind of the downside with typhoid in the injectable form.
Right. So aside from being immunocompromised, is there any reason for you to kind of get the injectable over the oral, or are there other types of people that would prefer one over the other?
I would look at it and say that a lot of people like to get the injectable because, frankly, it's easy.
Right.
You're already in for the appointment. We give you the shot, you're done. You don't have to think about remembering to take the pills and that sort of thing. Now, with typhoid oral, there are a few things about it that we have to be mindful of. And one of them is it needs to be refrigerated. So you need to be able to keep the pills in a fridge. They're only good for, I think, less than 12 hours out of the fridge. So
Right.
so if you don't have access to a fridge, that can be a problem. You have to take the typhoid pills on an empty stomach, and you have to remember to take them because it's every other day for 7 days. So we want to make sure that they're being taken properly like that. And then also that you've got enough runway, enough time that you can actually take the pills and in
Right.
those 7 days. Because although I mentioned that typhoid injectable takes about 2 weeks to fully kick in, if you're leaving in 5 days on your trip, I would still give you the typhoid injectable on the basis that we can get that done and we can get it in you, and it would still provide you some benefit before the 2 weeks are up. And then if your trip's longer than that, it would provide the benefit then. But if you're leaving in 5 days, you can't finish the course of the typhoid oral. You can't actually do it because you can't take the pills with you, and you won't be able to finish them before you leave.
Right. Is there a price difference between the two of them?
No, actually, there's no price difference. So
Oh,
this is not something where you have to look at it from a financial standpoint. Both products are about $50, and so you're not there's not a significant difference. Like we charge exactly the same for each one, so you don't have to really worry about it from that standpoint.
right. Okay, that's interesting. I didn't know that it was kind of like a preference or a that sort of thing. So, in terms of other things that you can do to prevent typhoid, what can you do kind of besides getting vaccinated, considering that the vaccine only covers you for typhoid fever, not for paratyphoid, and that it's not like 100% effective?
I think how you would approach it is, use the sanitizer, hand sanitizer with alcohol, avoid tap water, be careful with your water sources. Raw foods are always probably a little bit more of a concern. I really, fruits and vegetables you have to be careful about, and unpasteurized dairy products. It's just a lot of food and water choices, but you'll probably have no idea what actually caused it if you ever get typhoid. So
Right.
I think that just a lot of common sense precautions in hand washing and sanitizer, that's all you can really do, because again, you can't really ask people or tell, or just if you went into the back of a kitchen in a restaurant in Mumbai, and you couldn't just walk through and say, hey, that guy, I think he's got typhoid. And there's
Right.
no way that you can tell.
Right, right. And you can't just go back there and give everyone a little squirt of hand sanitizer either, I guess.
Oh no, not really. No.
Okay. Is there anything else that you wanted to mention or talk about in terms of typhoid or anything else?
I guess the one other thing I'd want to mention is when it comes down to trying to decide whether you would want to do the oral or the injectable form of typhoid, I think it's a good conversation to have with someone who is going to prescribe it for you. But I kind of look at it a couple different ways. And I think it would probably just mention my general approach to how I handle these
Sure.
situations. So if you want quick and easy, do the shot. If you have a complicated medical history, or you're on antibiotics, or you have other medical conditions, do the shot. If you have a lot of gut issues and maybe typhoid oral can be irritating to people's guts, I'd get the shot. If you don't have time to do the oral, or you don't have a fridge, also do the shot. And if you're not really planning on doing a lot of travel over the next several years for high typhoid risk places, probably the shot is easier, because the difference between 2 to 3 years and 5 to 7 years don't matter too much.
Right.
But now at that point, you're saying, well, who would ever get the oral? Well, I can give you a good example of candidates that would be good for oral. Young, healthy people who are planning on traveling a lot. So if you are 20 some years old and you are planning a bunch of trips over the next several years, you're young, you're healthy, you don't have any medical conditions, you're not on antibiotics, guts are in good shape, I would probably look at doing that. So lots of times when I do recommend oral typhoid, it is to that younger, healthier, frequent traveling bunch, although not exclusively, but that's kind of the group of people that I kind of look at and say, hey, maybe we should think about going oral with these guys, as opposed to, somebody who's like in their 50s and already has a bunch of gut problems, and they're just going on 1 2 week trip, and they don't think they're likely to be doing tons of travel in the next 5 years.
Right. So, kind of, I guess another question then would be how often do you kind of prescribe it in general or recommend that people get it, considering that there's like quite a few different risk areas?
Anyone going to South Asia, I highly recommend. I would recommend it to all travelers going to that part of the world. And that being said, same with Southeast Asia. So when you look at the map, I'm looking at my map right in front of me here. I would basically say that once you basically go from the Middle East all the way across to, your Afghanistan, Pakistan, India, Nepal, Burma, Thailand, Cambodia, Laos, Vietnam, Philippines, Indonesia, Papua New Guinea, all those places, I would do it. When you start talking about China, the risk is definitely lower in China, and Korea, Japan, really not something that we would think about as much. But also you'd want to look at duration of trip and what your activities are going to be. So in those locations, I pretty much recommend it for most everybody.
Right.
And certainly into Africa, kind of the same situation. But when you start looking at places that I don't view as being as risky for typhoid, like some of the places in Latin America, sometimes I would say, if you're going to be there for a long time, if you're going to be doing more local things, that would increase my recommendation for doing typhoid. Your chances of getting typhoid in Central America, like in Costa Rica, if you're going for a couple weeks and you're renting a place on the ocean, not really that high. But if you were planning on moving down to Costa Rica every winter, I would probably be thinking, yeah, you should be getting this done. So
Right.
in some of those Latin American countries, I think that would be sort of what tips the scales for me from that approach. But when you start thinking about those countries in South Asia, I don't think it really matters how long you're going for. I would just want to get it done. And one of the things that I think I'll just mention here too, and I think just so people know, is that most of the cases that we see in Canada are in people that are visiting family, and there isn't necessarily any long-term immunity. If you had typhoid, many years ago, or if you grew up in an area and maybe you never knew if you had typhoid, you're not going to necessarily be protected. So when you go back to visit family, this is definitely something which should be on your radar screen.
Right, right. Kind of another thing that I just thought of with the oral typhoid vaccine, can it interact with any other drugs that you might be taking or any other kind of like, do you have to separate it from other vaccines? Should you be concerned about taking, say, like an anti-malarial at the same time if you were going to somewhere like Africa?
Yeah, actually, good point, because there is some concerns about taking oral typhoid and antimalarials concurrently.
Right,
So right now, if you're on antibiotics for whatever reason, you don't want to be taking the oral typhoid, and you also want to space that out by usually more than a week. Geez, off the top of my head, I can't remember if it's 1 week or 2 weeks, but you definitely want there to be a buffer zone in there after you're done taking antibiotics and before you start taking the oral typhoid. And
sure.
antimalarials can be a concern as well. And then the other thing is too, you can't take oral typhoid with anything else. You have to have it on an empty stomach. So that would be a consideration. If you are on other meds, you can't take your other meds at the same time.
Right.
So you want to make sure to have it all separate out. So one of the things we will sometimes see is that people that are taking meds a couple times a day, you have to take on an empty stomach and not with your other meds. So then you've got to figure out a time that works. Maybe that's the middle of the afternoon or something like that. But we just have to kind of be mindful of all that.
Right, right. It requires a little bit of scheduling and coordination, it seems.
Definitely. And the other thing I should probably mention to you as well, just again, more for interest's sake, Dukoral, which is really the only other oral vaccine that we typically do.
Right,
If you do Dukoral and oral typhoid, you got to separate them out by, I believe it's a minimum of 12 hours. I've always tell people don't take them the same day.
right.
If you start taking your oral typhoid on day 1, day 3, day 5, day 7, do your Dukoral on day 2, for example. Like just pick an entirely separate day.
Right, right. Because they can they interact with each other?
Potentially, yeah. And it's recommended that they should be separated. So, and actually that just made me think of something we didn't talk about, which I'm going to throw in there as an additional bit. Very often we'll get questions from people that mess up their schedule on the oral typhoid
Right,
because it's the day 1, day 3, day 5, day 7. So people will call us and say, oh, I forgot. So the short answer is, if you forget, it doesn't wreck everything. But the
right,
one thing we don't want to happen is for you ever to take on 2 consecutive days. The principle that with a vaccine, usually shorter than recommended intervals is worse. and longer than duration intervals is not usually a problem. So
Right.
here's what we would do. You take it on day 1. You're supposed to take it on day 3. Well, you forgot because you forgot. So then you would take it on day 4. And then I would flip over and go to day 6 and day 8. So you would do a 1, 4, 6, 8. And that would be just fine. You don't need to restart. It's still going to be effective. It's going to take 7 days from that last dose. So it'll really fully kick in on day 14, but day 15, but that will work. So you could do 1, 4, 6, 8, or you could do 1, 3, 6, 8, or even if it was 1, 5, 7, 9, it's not ideal, but it would work. We wouldn't restart the series.
Right. And how come you can't take them 2 days in a row? Is it just won't work, or too hard on the body, or?
What we're waiting for is we're waiting for the body to create an immune response. So each time you take the pill, you're essentially stimulating that immune response. We want to give your body time to start to gather and create a response. So if you do it on 2 consecutive days, it's really too fast for your immune system, is what it amounts to. So that's why separating it out by the day provides that. And then if you are long on it and you take 2 days between, it's not a big deal necessarily, because, well, like I said, your body will still be primed up from 2 days earlier. But if you wait, like I said, if you do it the next day, your body's just not essentially ready for that second dose yet to create the proper response.
Right. It hasn't had time to do its thing yet in a very non-scientific way.
Yeah, really. Exactly. And then as a general principle with most vaccines, now everything is different. And I don't want to throw this out as a complete blanket statement, but generally speaking, if you are late on a vaccine for your booster dose, it's usually not as much of a problem. Like if you're doing some other vaccine, random vaccine that is 6 months apart, first dose today, second dose in 6 months.
Right.
Well, you would be far better off doing it in 7 or 8 or 9 months as opposed to doing it in 5 months. If you get it in 5 months, I'd be like a bit concerned that you're not going to get the proper response. But at longer, 7, 8 months, it's fine.
Cool. Good to know. Good to know. Anything else you want to mention?
I think we came up with some extra stuff here quite well already. So I don't think I've got anything else right now. So I think that's a pretty decent wrap up of typhoid, and kind of explains where we're at with that and what we can do. And yeah.
Awesome. All right. Well, thank you for tuning in to this week's edition of the Polaris Travel Health Podcast. A reminder that the information and advice that we provided in this podcast today are not a substitute for live medical advice tailored to your itinerary and your medical history. If you have questions or you want to book an appointment, please head over to our website, polaristravelclinic.ca. As well, check us out on Twitter at PolarisTravelRx and our Facebook page as well. We hope you'll tune in again with us next week.
Thanks, Jayden.
Thank you.